Two babies in Louisiana died in the past 6 months of a respiratory illness the doctors say is preventable.
The head physician at Manning Family Children's Hospital warns more deaths could come if parents don't take this seriously.
It may seem like the common cold at first, but this infection can be deadly.
The serious phase of the disease occurs when fits of coughing happen, and with those a child can have the oxygen level in the blood fall to a dangerous level. There can be seizures, damage to the brain, and even death in rare cases.
Dr. Mark Kline is talking about whooping cough, also known as pertussis. It's a highly contagious bacterial infection spread through respiratory droplets when an infected person coughs or sneezes. Kline says babies younger than 1 are at greatest risk for severe complications from whooping cough.
Small children have very narrow airways that are more prone to obstruction.
The state health department says about half of babies younger than 1 who get whooping cough will need hospital care. While symptoms start as a fever, runny nose, and slight cough, they can escalate quickly.
We have seen more cases of whooping cough over the past year or so. In Louisiana, there have been 120 plus cases of whooping cough.
According to CDC data, there were only 12 cases in the state the year before. Louisiana isn't alone.
In 2024, we saw 471 cases, which was a record for recent years.
Dr. Christina Bryant is the hospital epidemiologist at Norton Children's Hospital in Louisville, Kentucky.
We have certainly had children who have been hospitalized for pertussis in the last year.
Bryant also serves on the American Academy of Pediatrics Committee on Infectious Diseases.
We are going to see more cases of whooping cough. CDC has been saying for a number of months now that we're going to see more cases both in vaccinated children and unvaccinated children.
Health experts agree the best way to prevent whooping cough is through vaccination, but it's not a one-time shot.
It's given to young infants at 2, 4, and 6 months of age, and then to toddlers at about 18 months of age, and then just before a child starts school, typically at 4 to 5 years of age.
That's the primary series of vaccinations called the DTaP. Then the Tdap is recommended for kids age 10 or 11, as well as pregnant women and other adults who haven't gotten it. But Kline says the recommendation isn't always followed.
All of the children that we have seen with whooping cough over the past year have been unvaccinated.
According to Kline, doctors treated 10 kids at Children's in the past 6 months for whooping cough. Some of them ended up in the ICU.
Almost all of the children who suffer serious complications from whooping cough either are unvaccinated or undervaccinated. They have not completed that primary series of vaccination.
Taking a look at state health department data, the percentage of kindergartners in Louisiana who started the school year in 2021 having received the DTaP vaccine was 91.32%. The DTaP vaccine includes pertussis, diphtheria, and tetanus. By 2023, the number dropped to 90.45%. The state health department says 2 infants died in Louisiana in the last 6 months. Before that, the last death from whooping cough in the state was in 2018.
We thought that we were on pace to eliminate diseases like whooping cough.
Last week, Louisiana Surgeon General Ralph Abraham sent a letter to local health departments informing them that the state will no longer promote mass vaccinations. In New Orleans, Health Director Dr. Jennifer Avegno pushes back.
We do not have to follow this, and we will not be following this. We will continue to promote vaccination of all kinds.
The new state guidance is making national headlines.
A lot of great concern about what's happening in Louisiana. The health department is supposed to be the trusted communicator for your community for all things health. And they pull back on that. They're not giving people the information that they really need.
Doctors fear if more people choose not to vaccinate their kids,
numbers will climb.
It's an absolute tragedy, and honestly, nothing I would have imagined when I was training in pediatrics.
This week, the State Medical Society sent an open letter stressing the importance of vaccines. The letter mentioned whooping cough and that Louisiana doctors are treating it today despite the fact that it's vaccine preventable.